Benjamin Dermer's daughter is fully vaccinated, but his family's planning on heading to Quebec for March break, where 7 cases of measles have been confirmed.
My questions would be, is this alarming? I know there are potential serious outcomes, but I have no sense of whether or not these outbreaks are really significant in my life.
Quebec is promising an update on Monday. What's worrying doctors there most is community spread, unrelated cases with unknown origins in the Montreal area.
It really is just the tip of the iceberg, because where did they get it? From whom, and who are that person that they got it from? To who else are they spreading it?
Public health is tracking down who might have been exposed, but doctors say measles is so contagious, it's a tough job.
It can stay in the air if someone's in a hospital room or in a waiting room. It can linger in the air for a while. So that patient may be gone, but someone else comes in and they may be exposed.
Canada eliminated measles back in 1998, but vaccination rates have been backsliding. In 2021, just 79% of 7-year-olds had 2 doses of the vaccine. The World Health Organization says 95% of the population needs to be vaccinated to maintain measles herd immunity.
If we start to see community spread of measles, we're going to start to see more cases, and unfortunately, the consequence of that, more severe cases and, potentially very young people ending up in hospital.
Children under 1, people who aren't immunized, or who are immunocompromised are most at risk. In the U.S., the Centers for Disease Control confirmed 41 cases in 16 states, 10 in Florida, most at an elementary school near popular spring break destination, Fort Lauderdale.
It makes me a little concerned. So my daughter's fully vaccinated, but my son can't get his second one until he is 4. And he's high risk for a lot of other issues.
Worries that may soon spill over to parents on this side of the border.
Katie, let's get back to the question the father asked at the beginning of your story. What's the risk?
Well, the number of shots has changed over the years. So depending on when you were born, you might want to check with your doctor whether you're fully immunized. Adults who've undergone chemo or who have other underlying health issues might want to consult their doctors about getting boosters. Now, Dr. Banerjee says very young infants get some antibodies from their mothers and from breast milk that lasts up to about 6 months. And she says you can give a child a measles shot as early as 9 months. And you can also bump up your child's vaccination schedule to get a second shot earlier if there is an increased risk. But she says if you're really worried about catching measles on spring break, maybe don't go to a place where there's a known outbreak.
Katie Nicholson reporting from Toronto.